Yeah, this one is called "This Pandemic Will Lead to Social Revolutions." It's on Bloomberg, and this is something that we've talked about in previous episodes. We talked about it in the Iran episode, that when something like this happens, when you have an epidemic, we can talk about how many people are going to die. We can talk about what the cost is going to be to the economy. We can talk about the sort of first order effects. But what this can do is shake things loose politically. Now, there in Hong Kong, there was sort of a revolution going on in the streets right before Corona broke out, and now everybody is indoors. That's been put on the back burner. That's been brought to a complete halt. But once the smoke clears, once we're past this epidemic, once basically either everybody has it or we have herd immunity or we've somehow come to grips with this, we're going to see a lot of political turmoil. Maybe not in the United States, although I wouldn't rule it out. And certainly if it gets worse, because we still don't have an exit strategy for how we're going to deal with the lockdowns. You and I have talked about the South Korean model that focuses a lot on track and trace and heavy testing, and we're just not doing that right now. We're not testing in nearly the numbers that we need to be. And so we have people who are going to be locked up in their houses, essentially. We have people who've lost their jobs. And this is affecting the poor disproportionately. Now, a lot of Republicans, including myself, laughed when we started hearing Democrats say that this was affecting Black and Hispanic Americans more than whites. But now we're seeing that the numbers are in, and it's clear Blacks and Hispanics are twice as likely to die from coronavirus in the United States. And that's perhaps, I'm sort of speculating here because I don't have the data. I don't have proof of the causality. But I strongly suspect it has to do with the jobs that people have. If you work at an office job that you can do from your desk, then you can use Zoom. You can just work from your home computer, from your home office, and it's not a big deal. But if you are, say, driving an Amazon delivery truck, if you're working a job where you're in contact with the public, then you're exposed to much more risk. You and I talked about, I think off the air last week, that you go to fast food places. A lot of fast food places, people aren't wearing masks. Why is that happening? Because they're not being provided with it, and there are no guidelines. There's no requirements. They're just being sort of thrown out there. And a lot of people, let's face it, they're going to fast food. They're going to drive through, and the people at the restaurant don't have PPE. It's just like the people working in grocery stores. It's just like the doctors and nurses and police officers who are out there facing the public. Now we're starting to get PPE to our police officers, but we need to get it to everybody who is working. This is this. So anyway,
I don't disagree with that. Obviously, I'm a big advocate of masks for all, but I do want to mention that there is evidence that vitamin D deficiency might actually be the bigger issue. In fact, I've tried to bring that up with anybody that would hopefully listen to me, but of course, it's hard to get national figures like the Surgeon General to address that. I'm reading a study right in front of my face that talks about how vitamin D, lack of vitamin D, causes problems in respiratory health, and this is an angle that I'll actually be researching more as time goes by.
Okay, and they think that's the reason behind the disparity, the class and racial disparity here in the United States.
No, they being the authorities aren't taking this seriously at all. This is something that I've discovered in my own research and also with some of the other sources that I use to get information. People, by the way, that have been talking about this pandemic long before the Surgeon General was, or Dr. Fauci, or any of these people were talking about or taking it seriously. There were others that were, and were trying to warn us. And that's the kind of people that I try to listen to. And they have brought up this vitamin D issue because there's a theory that says the only reason that you are white, Peter, is because of vitamin D, because as a white person, you process vitamin D better than a darker skinned person. That is the actual evolutionary adaptation of why white people exist. It's a theory. And it's backed up by the evidence that apparently people of color do not process vitamin D as well as lighter skinned people do. So if you think about all these people that are stuck at home and they are not going outside and getting the vitamin D that they naturally can get from the sun, and they're staying in houses, that would actually make sense that they would be hit harder than, say, white people who do process vitamin D more easily and therefore don't need to be outside as much.
That's really interesting. I hadn't even thought of that point. Wow.
It's not being brought up. That's my point. It's not being brought up in the mainstream media at all. So
yeah. And as this continues, we need to ask, again, what are going to be the second order effects? If people are thrown out of work, that can cause social unrest because people can riot simply because there aren't enough jobs. There's not enough food. We've talked about the supply chain being affected, that we don't really know what to do about trucking because truckers are exposed in all of this. If they get sick, well, somebody needs to drive that truck if that food is going to get to the next location. You have the fact that a lot of our supply chains are built on the fact that you have, for example, people who deliver food to restaurants maybe aren't set up to deliver those to grocery stores. They would have to rework their business model to serve grocery stores with the same supplies as they would serve restaurants, if that makes sense. Same thing with toilet paper. We have a lot of toilet paper that's produced on huge rolls, which is suitable for, say, an office or a public restroom, but it's not suitable for your home because you're a home dispenser. So there are all these knock-on effects to what's going on with coronavirus. But perhaps the most serious one would be if people do start dying in serious numbers. And right now we've only had about, I want to say 15,000 Americans, 15 or 20,000 Americans die from this. So hopefully we don't see a huge increase. I think we might be starting to see this wave crest a little bit. But in countries in the third world where they don't have nearly the same health system, they don't have the same protections, they don't have the same plan in place, they're a lot more vulnerable. The question is the economy going to collapse faster or the number of workers? If the number of workers collapses, but the economy is basically intact because they don't have the same economic structure that we do, then you could see wages rise. And then the people in power might not respond very well to that. But if the economy collapses, which I think is perhaps more likely, then the workers have something else to be really upset about. We've seen prison riots across the Middle East that we've talked about. In Brazil, people are banging pots and pans, which is something in Latin America, which oftentimes in Chile, for example, preceded the revolution against Allende, was banging pots and pans. It's a well-known idiom, if you will, in Latin America for revolution. And you have countries like Bolivia that we're starting to hear, not just Venezuela or Cuba or countries like that, the places where you might expect that there would already be discontent. But we're starting to see in Bolivia, a country that we don't really hear very much about, that we're starting to hear about discontent. And again, once this shakes out, we aren't at the end of this by any stretch. We have no idea how this is really going to affect the third world, and we can expect this is going to get a lot uglier.